Yeah, let's get in the chiropractic corner. What do we got this week?
We got neck pain. We got a picture here. Very interesting picture.
Yeah.
On the left, we have a normal cervical curve versus a reverse cervical curve.
Mm-hmm.
Cervical curve is known as a lordotic curve and also known as a secondary curve, correct?
Yeah.
How do we get that cervical curve?
We're not born with it. So we get it when crawling. That's why belly time is so important for babies. When you're on belly time, they're trying to lift up their head, and that's why they have a hard time lifting up their head, because the curve isn't there to bring it back. So that's why belly time and crawling is so important, because that same lordotic curve that's in the neck is in the low back.
Yes, sir.
And so it's funny because we just had a patient last week, 2 weeks ago. Do you remember that straight lumbar curve?
There's so many of them.
Yeah, it was so straight. And the first thing I told him was, your parents told you that you went straight from sitting to walking, right? He goes, yeah, how'd you know that? I go, you didn't crawl. You were destined for back pain.
I love their reaction. They say, how'd you know?
Yeah. So same thing with this. And that used to be the case with cervical curvature. Like when we see a lost curvature, it's either trauma, accident, or they just never had belly time when they were younger. Now it's different. Now, computers, phones, they're constantly down in this position
text
here.
Neck, all that good stuff.
Yeah, so explain tech neck.
Basically, happens around like C6 area, C5, where your neck's constantly going downwards. The best way to hold your phone is actually bringing your phone up and looking at it instead of bending all the way down.
Yeah.
Because if you're like this for so long, eventually you're going to develop a hunchback.
Yeah.
Over the years of time, you're going to look like the Notre Dame hunchback.
Yeah. And that's why, working on that curvature, we have deep flexor muscles, and we'll get into treatments and stuff like that you could do at home. And you like doing the tucking and all that
like
stuff.
Tucks.
You'll start showing that right now.
On your back.
Yeah.
Making a double chin.
Yeah. So some symptoms that they end up getting: burning, aching, sharp, shooting, electric, numbing, tingling, spasms. Let's go through each one of those, because a lot of people don't know which symptoms mean what. Mm-hmm. And even when you ask them, like, hey, what is the symptom? Is it sharp? I don't know. You know what I'm saying? It's pain.
Hurts.
It hurts, right?
Yeah.
So let's explain some of those. Burning. A lot of the burning that I hear is more or less truthfully weakness of muscles or a spasm muscle. A lot of the burning, from my experience, from what I've seen, is actually coming from the muscle. Unless it's a massive impingement, there's inflammation, that burning could be heat coming off.
Right?
It could be arterial, but for the most part, when they say like it's burning, it seems more or less where this muscle's weak and it's having a hard time. It's tired. It's either weak or overused. Okay. Yeah. Aching. How do you explain that?
I go straight to muscle. A lot of times when the muscle's super tight, you get the achy feeling when it's impinged. Mm-hmm. So any certain movement, moving up, moving lateral, whatever it is, you're going to feel that achiness in the muscle, and you can't completely get to where you want to go.
Yeah.
It's just a constant ache.
So that's on like, I get that too when they say like a superficial ache.
Yeah.
When they start telling me it's like a deep ache, I go straight to bone and joint.
Mm-hmm.
And that bone and joint at that point with a deep ache is more like a toothache. Like if you've ever had a toothache, it's in the bone, it's in the nerve. It's just starting to irritate the crap out of that bone and joint. And that's where you don't feel inflamed, but it just feels like every little motion you do
just
hurts. And it's just a constant. An ache never really gets to like a 9-10. It's usually just consistent, annoying, anywhere from a 3 to an 8.
These are the ones that wake you up, the aches and pains.
It's more like the sharp stabbing that wake you up like crazy. But the ache could, because it's constantly there. Every move you make, it might intensify. Sharp.
You go straight nerve.
Sharp shooting, electric. All three of those are nerve. I hear sharp, shooting, electric. It's a nerve impingement. Where is the nerve getting pinched? We usually do that through exams and all that other stuff, which we'll get into how we end up looking at that.
But your first thought is like
nerve.
This.
Disc. Well, either disc or subluxation. Both moved out of place, pinching a nerve.
Yeah.
But for the most part, it's disc, because if you look at that picture that's still up there, when you see these disc spaces getting smaller, it's the black space in between the bones. Mm-hmm. That's the disc getting a lot smaller, and those are your shock absorbers. Those are making sure that nothing's pinching on that nerve.
That's your last barrier between bone and bone.
Yeah, so if those things start getting smaller, those shock absorbers aren't there. Imagine the shocks in your guys' cars. If the shock isn't there, you're feeling every bump on the road. Yeah. Well, if that shock of the disc isn't there, well, you're going to feel every step, every jump, every movement, everything at that point.
And then your hole where the nerve comes out from, known as the IVF, decreases as well. And there's a lot of things going through that.
Yeah, and that's where you get like the medical terminology of like foraminal stenosis. That just means narrowing smaller of that opening where that nerve comes in.
Big words are scary.
They're scary. They're scary. But if you know how to interpret them, they're not that scary. Because like even like if in this picture where we see those discs getting smaller or we see bony spurs, another scary one that everyone loves to use is degenerative disc disease. That sounds scary as all hell. Okay. And it could be arthritis of the spine. It could be degenerative disease. It could be radiculopathy. Sounds scary. And that's just the symptoms of it coming down.
Broken down, they're not
so it's
scary.
just knowing what it is, it's a big difference there.
I feel like a lot of medical professionals do a bad job of that, though. They just toss this diagnosis out.
Yeah.
And then people come to us like, oh my God. Like, I had a patient not too long ago. They came to me and they're like, oh my God, I just had an MRI and look what I have. I have thinning of the disc, this and that.
Yeah.
Well, worded completely different.
Yeah.
Like discitis or like you just said, like IVF encroachment.
Encroachment,
like,
foraminal stenosis.
They're looking at me like, oh my God. I'm like, we talked about all this before.
I told you all this already.
But not on the vocabulary level
Yeah.
of what was described to you.
Yeah.
A lot lower.
Yeah, and we try not to. We try not to. And he's gonna yell at you for that one. I can't wait till he hears that.
Whoa.
Yeah, hears he.
Oh my God. When that popped, I'm like, he's looking at me.
But yeah, no, it's just looking at the words and knowing how to break down the terminology. And that's one thing, like when people get reports, and that's the one thing I hate about that Beaumont My Chart is like people go do an MRI or they'll do anything. It's awesome that they could get their medical records. It makes my life that much easier. That way we don't got to request it. But
it's just so
when
wordy.
patients start reading it and then they take that foraminal encroachment or foraminal stenosis and then go on to WebMD, and it's scary. Everything is surgery, and they just start getting scared at that point. And they think that that's their only hope. Where there's a lot of other things that you could do, even stuff that you could do at home. Which we'll get into.
Like
Arthritis degeneration is not just an age thing, man. Like, I mean, we seen about a month ago, we seen a 65-year-old cervical spine. I was expecting to see degeneration. She still had a beautiful curve. We seen no bony spurs. We seen no decreased disc space. They were diminished. They weren't textbook normal from when she was 15 years old.
Yeah, but you were surprised at the structure.
Oh my God. And I see other 17-year-olds.
You look at 17-year-olds and you think they're 70-year-olds.
You think they're 60, 70 years old. So it's truthfully lifestyle, man. It's
wear and tear. That's what it is.
Yeah, but just because you get older doesn't mean you're predestined to aches and pains.
Get your oil changed.
Right? So you have to keep on doing those things and maintain it, and not just come to the chiro. Exercise, water, diet. We could say that nonstop. Because if you do your exercises, you're going to keep that curve within the spine. The alignment may not be there. There might still be bones shifted out of place, pinching the nerve, but
you could be better.
Okay.
You could be better. Make sure that you're not going down that phase.
Yeah. So, and then I know we both like messing with muscles a lot because, muscles attach bone to bone and all that other stuff, and it's just a matter of how we go about it that way. So give some of your exercises that we do for this loss of curvature. I know the chin tucks and all that stuff.
So you do chin tucks where like you're basically making a double chin. Best way to do it is just put your finger on your chin and just force your neck inwards, basically. Yeah. Another one you could do is same exact thing, a little more intense. Lay on your back, same thing. Drive your chin through the table. Mm-hmm. Your favorite one is when someone's in bed, lay your head off the bed, basically, and allow gravity to do its work.
Yeah.
And then we also have cervical pillows in office that we just got.
Yeah. So those ones are awesome. We're going to be up on our website here shortly. But also we have, like those posture braces. Yeah. I hated them at first because some of the braces that I was reading, it'll help this anterior head carriage where this head's all the way up here.
That's how you get your hunchback.
A lot of the braces were sort of saying, just wear this all day, we got it, whatever. And they weren't more of like the elastic rubber bands that we use for exercises, like the TheraBands. Mm-hmm. They were more just braces, right? And they were wearing it all day and keeping them up here, so on and so forth. The ones that I found that I was talking to the seminar this weekend they were like TheraBands, and you put them around your shoulders and it holds you up here, and it's just literally 10 minutes a day. 10 minutes a day will start activating those muscles a little bit more, especially like when you're sitting at a computer or sitting something along those lines.
So you're not dependent
to keep you up here, so you're not dependent on it. And then the cool thing about them is come with the full booklet, everything to teach you exercise that you could do, because then you could step on them, do rhomboid rows, which brings these shoulder blades back.
Rhomboids, man. Everyone's rhomboids are shot.
Horrible. Everybody needs rhomboid exercise just to bring up this back here. You could put it around the door, do lat pull downs.
Do a bunch of things with them.
You could. The coolest thing about it is the way that it's set up. You could put it in the back of your head and start doing extension exercises with it, with the band. So there's a lot of different exercises with these posture, thoracic postures that you could actually help out with these bands.
It takes time to get better.
It takes a lot of time.
It takes time, and that's the biggest.
And it's never too late to start.
That people look at chiropractic.
Yeah.
It's like, oh, how long do I got to do this for? And it's your part too. If you do your exercises and we do our part, we'll get you better pretty fast.
Yeah.
Well, if we're only doing our part, it's going
to take time. It's going to take time. And it's never too late to start.
Yeah, you could always.
Whether it's chiro, whether it's PT, whether it's exercise on your own, it's never too late to start to get out of pain, because age is just a number. You know what I'm saying? So it's just a matter of, I look at 60, 70-year-olds that come into the office and they're active, they're moving around, they're doing everything they need to be doing. And I look at other 60, 70-year-olds and they're on a cane. And it's just, what did you do prior to that to cause that, right? And you can be predestined, you can have bad genes, so on and so, but genes, it's been proven that genes can be turned off through proper habits. You know what I'm saying? So, I'm more susceptible to high cholesterol. I'm more susceptible to high blood pressure. It runs in my family. How do I combat that? Diet and exercise.
Yeah.
Okay.
Take care of yourself.
Yeah. Radiculopathy. Scary word. Explain it.
A lot of times we see this associated with the disc, any basically sensation going downwards typically. A lot of times when we have neck pain, first question we ask, is it shooting into the shoulders, going down the arm, into the fingers? When there is compression of a nerve, sometimes we feel that.
Yeah.
And a lot of times we see it with just thinning discs, decreasing the IVF space, putting pressure on that nerve. And those spines that we show people don't understand that these actual nerves travel throughout the whole body.
Yeah.
It's just a little simulation of what we're seeing. And I always try to mention that.
It's going all the way down the arm.
Yeah, it's going all the way down the arm. It's controlling, innervating, whatever word you want to use, specific portions of the body. And we could do a lot of things for that.
Yeah.
So a lot of things.
I want to go back real quick to the weak spasm muscles. When we're talking about weak, deep muscle groups, we talked about the chin tucks, spasm levators, which is this muscle right in here that raises the shoulder blade up, and then tight traps, spasm traps. Those are, we could do muscle work for those all day. But one thing that everyone needs to understand is that, if you're not exercising, if you had no trauma, they're not sore. They feel sore. Why? The first symptom that you get from a pinched nerve is muscle spasms. Yeah. Muscle fatigue.
The muscle's not getting its juice.
It's not getting its energy. It's not getting the gas that it needs. So, that's something that you just got to look at that point. And then some things that we figure out, in office when we're doing the exam and x-rays is we do our orthos. We do our, muscles, sensory and reflex testing. We do all these things because before we even take the x-rays, actually they're there to confirm what our beliefs are.
Yeah, because 60% of your diagnosis, or even more, probably 80% of
history
your diagnosis
and exam.
is history.
History more than anything.
History, exam, putting that together. And at that time, when you're taking them to the exam room, you have a good idea of what's going on.
You have a good idea.
But yeah, I feel like a lot of people today, and I personally don't mention this diagnosis, but upper cross syndrome's all over the place.
Everywhere,
where a lot of people are going head is shifted anterior. Why? Because a lot of times what it is, there's antagonist muscles.
Yeah.
Pecs, very tight. Gonna bring you down, right?
Yeah.
So how do you fix a pec that's very tight? Stretch it out,
Stretch it out.
Stretch it out. And
what else do you gotta do?
You strengthen who?
Strengthen the backs.
Strengthen the back so you can come upright.
So that's upper cross and lower cross syndromes are huge, and that's huge in the PT world. And I would, there's a lot of PTs that don't even use that methodology, and it just drives me crazy because it's very good to be used. I know in the seminar that I was in this weekend, which I hate these seminars, but it was one of the doc does a lot of integrative medicine. He has a PT on staff, and that's all they do. So he does the chiro portion, and then he's got a medical doc that does trigger point injections, and then he's got a PT on staff that does all the rehabilitation. Yeah. And that's all they do is upper cross and lower cross. That's it. They don't do it. That's all PT's responsible for. Chiros do their adjustments, their myofascial cupping, all that other stuff, and then your trigger point injections. So that is it's a good way to get people better.
Do you like that setup where you're seeing a chiro, PT, and medical doctor in the same?
I love it, but it's at the same time my issue with it is you just got to find the right practitioners that are on the same page.
Do you think there's ever a situation where you're getting too much care?
No.
You don't think so?
No, because it's our job when they're in the office to not overcommit care, right? I mean, if they come in and say, for example, chiro does trigger point therapy and all that other stuff, right? Adjustments, stretches. Well, when they go to PT, they can't do the same exact stuff. It's got to be separate. Yeah. So when it's all in the same house, there's communication there. When it's different places,
communication needs to be lobbying.
It's in there. So I don't think there's too much at that point. Now, when a patient comes and sees us and they do PT as well, same day, Well, I always ask them, well, what did they do?
Yeah, same.
Because if they did electrical stimulation or they did,
You're not gonna do
ultrasound,
another-
I'm not going to go and do another one
no.
because that might tire out the muscle. I got to know what they did so I could do the opposite things. So that's
Or
where
take it easy on
the
them,
lack
you
of,
know?
or take it easy on them. So yes, you can overtreat at that point, but I feel like when it's all in the same house,
You have a good idea.
you have a good idea of what's going on, and everyone has their game plan.
No, I agree.
and no, I like that a lot actually.
I agree.
So those are some solution and treatments. I think, neck pain is everyone's dealing with it. I think one of the most reason people go to the hospital is because of their low back pain and neck pain. So, it's just, there's other solutions. There's things that we could do. And it's just a matter of finding the right solution and finding
Biggest
what
thing
causes it.
too is if you're feeling mild low back pain right now, check it out before
Check it
it
out
gets
first.
to that chronic issue
Yeah.
of like, I can't.
Please
move
don't come in on
anymore.
a cane.
Don't.
We've
Check
had
it out
them.
so we can
Yeah.
get it. Boom, better
Yeah.
than there, no more.
Yeah.
Because your probability of getting better when you're at a 4 out of 10 and your probability of getting better when you're at a 9 out of 10, obviously your 4 out of 10 is going to be better.
Easier,
Easier,
faster.
yeah.
And you could actually resolve it, we got people, like that one patient that started with me in Livonia, ended up with you in Canton. He walked in on a walker and a cane.
Yeah.
He's, daddy daughter dance. Can't wait to go with his daughter, and he's
Daughter,
actually
daddy
doing
dance coming
training
up.
for this and actually doing the dances.
Yeah.
It's not just a little side
Great
step. There's-
patient, though.
Awesome
Great
patient.
patient,
He's done everything he had to do.
exercises,
Yeah.
We tell him do something, he's going to do it.
Yeah,
He's awesome.
He's awesome.